Healthcare is on life support. The insurance exchange co-ops are going bankrupt. The private insurance industry is pulling out of the state exchanges. Healthcare premiums are skyrocketing. Up to 60% are scheduled for 2017. Doctors' offices are shutting down. Hospital systems are losing money, and pharmaceutical companies are charging exorbitant amounts of money for life-saving medications without any repercussions. So, who's the boss? Who's in charge of healthcare right now? Is it the doctor? Doctors are too busy with their daily activities to really be able to engage too much in healthcare policy. Who's in charge right now is the federal government. The federal government, with the Department of Health and Human Services, is a powerhouse. It controls the FDA, the CDC, the NIH, and also the CMS, which is the Center for Medicare and Medicaid Services. This is how a lot of doctors and hospitals are paid. And whatever changes they make, the private insurance industry also follows suit. So it's very, very important. Then there's the tech industry, which is new to the picture. And we have an image here of Reid Hoffman, who's the co-founder of LinkedIn. He's very interested in healthcare technology. And right now, in the last 2 years, we've seen $4 billion per year in expenditure on healthcare technology, which was never there before. And why is everyone so interested in healthcare technology and healthcare in general? It's because it's a $3 trillion industry. It's over 17% of our GDP. So it's very, very important, and everyone is interested in it. They're looking at some way to disrupt this industry. And the best example of this is Uber and how it disrupted the transportation industry. In 6 years, it went from 0 to being in 66 countries and 507 cities. And it revolutionized the transportation industry and made it so convenient and easy. So now we're looking at ways that we can do the same thing in the healthcare industry. But the health industry is very complex, and it's very difficult to create technology that will be able to function throughout the whole entire system. Another issue is doctors are not on board. And many of them have not even adopted electronic medical records. And the ones that have are usually complaining about the efficiencies and the difficulty in using this kind of software. And what the tech industry envisions is a whole new paradigm where healthcare will change so much. It's going to be like a blank slate where they're going to change the way healthcare is delivered and also change who delivers healthcare. And so this is already happening because we've gone from a period of time when only doctors were the ones that took care of patients. And now we have providers, which includes physician assistants and also nurse practitioners that function kind of in the same way. And as time goes on, we're going to see more and more different types of providers that are going to do the jobs that were traditionally done by physicians. And so in 2014, in came Obamacare and changed healthcare in the US. And what it did was it expanded healthcare. And what it really expanded was Medicaid services, which are insurance for the poor. And this is our safety net program. So what we've noticed is that the private industry has been kind of mimicking the Medi-Cal model, or the Medicaid model and Medi-Cal in California. And this is basically destroying the way health insurance is providing care for patients and how they reimburse. So we're seeing a slowly worsening situation with health insurance industries where they're paying less and they're providing less services, and they're also having narrow networks where there's less doctors in the network. We also have MACRA, which is the Medicare Access and Chip Reauthorization Act of 2015. This is very important because it transitions Medicare into a value-based system from a fee-for-service basis. And this is going to change the way private insurers pay doctors as well. What does that do? That basically makes it very difficult for private physicians' offices to stay in practice. And many of them are closing their offices or selling their practices. And the bottom line is when you take a bunch of doctors that are competing against each other to drive the cost down and we start shutting down these offices, what happens is the cost of healthcare will go up. And additionally, the Affordable Care Act also incentivizes the healthcare industry to start consolidating. And basically what we're seeing is major or mega mergers of health insurance companies forming monopolies, such as Aetna and Humana and Cigna and Anthem. These are going to change, and also they're going to bring up the cost of healthcare. So what type of things are going to disrupt the system? There's a lot of healthcare technologies that are in the forefront that are going to make a huge difference in healthcare. And the first one is interoperability. And this is basically where we connect everyone's information together. Once everyone's information is connected, you have something called big data. And big data will change so much because with big data comes big data analytics. And this is going to change the way we do research. And we're going to be able to get answers to many, many questions much quicker than traditional research studies typically provide. Then we have telemedicine and virtual visits. In our office, we're doing virtual visits. And this is a convenience for patients. They can log on from the comfort of their home or office, and they can have a consultation with a doctor who can diagnose and also provide treatments directly to their pharmacy if necessary. Other things that are going to revolutionize healthcare is automation. Automation is all around us, but it's going to transform the way we provide primary care and preventive care services. For preventive care, all you need is a birth date and a sex, and we can determine all the screening tests that would be necessary for you. A phone call could be made to your house or to your cell phone and remind you that you need your breast exam and mammogram and pap smear, that you need to get your immunizations. And those calls will keep coming until you get those things done. So automation is going to change the way we deliver healthcare, and also potentially make some of the delivery electronic without the need for doctor's orders. What we're going to see is healthcare facilities are also going to change. And what we're seeing now is that a lot of hospital systems are in trouble, and they're going to continue to be in trouble for one of two reasons. Number one, because they're the most expensive place to get health care. And number two, they're also very dangerous places to be if you don't need to be there. So what we'll see is hospital systems that will start having massive intensive care units, such as pediatric ICU, cardiac ICU, neuro ICU, surgical ICU, trauma ICU. So these will be where only sick patients, very, very sick patients, will be housed, and anyone else should be taken care of in the outpatient setting. And that's where outpatient medicine is really going to flourish. And what we need is outpatient services with more diagnostic testing and more ability to take care of most problems without actually going to an emergency room or a hospital. And that's what we do at Urgent 9 Urgent Care, is we provide care for a higher level acuity patient population. What we do is we have x-rays, ultrasounds, CT scans, IV fluids, basic blood testing, and small procedures that we do in-house, and we can prevent potentially 85% of patients from going to the emergency room unnecessarily. Also, we've innovated ways to take care of patients that do not have insurance and make sure that they get the correct diagnosis and the treatment without a lot of the cost associated. And we have something called our Everything Plan, which is a $4.99 price tag that gives patients 1 week of care where they can get all the services that are offered in our office for that one low price. So hopefully you've enjoyed this presentation. Thank you very much.